Good afternoon, everyone. Judy Maggio with Austin PBS's Decibel. We're a few minutes after 3, ironing out our technical issues, but I think we're live now with Austin Mayor Steve Adler, and we certainly appreciate you giving us your time this afternoon, Mayor.
Judy, thanks for the invitation.
First question is just to briefly pull back the curtain for us. I know some big decisions have been made, canceling South by Southwest, putting the stay-at-home order in place. Who was at the table for those decisions? How did you make those key decisions for our community?
All hard decisions to make. All decisions with this virus, you're presented with options and you don't like any of them. But at the table, the prime seat was for the public health officials, the doctors, the physicians, the scientists. As we got to the second decision, we had more people in those chairs because we had more data and more modeling. We had the city manager joining the county judge and myself. We're working really closely, the city and the county. We've been lucky in this region to have a really close working relationship, not the case necessarily all across the state. So the public health officials, city manager bringing all the resources to bear of the city. And then in and out of the room, we had the business entities. South by Southwest was in and out of the room. And quite frankly, they were very supportive. They came to us very early and said that health was their primary concern, and they would cooperate and support anything that we wanted to do, and they did. That was probably the group. The decisions were not hard because we recognized that whatever we decided, a lot of people were going to get hurt.
So I want to ask you about what I'm calling the next normal, which arrives Friday with the governor's plan to reopen Texas gradually. Now, Austin and Texas have been famous for disagreeing on key issues. What do you agree with on this plan, and what gives you pause?
Well, we have been real successful in shutting down the virus transfer by the modelers say the equivalent of 94%. When we started this back in March, we had no idea we would be able to achieve that, and we have. But we also know we can't do that for the next year and a half. So dipping our toe in the water is a good thing to do. The governor's doing that. We don't know with this toe dip what that takes us to. If we dip below 80%, the modelers tell us we're going to be looking at another surge and having to then throttle back and do something different. But maybe we can stay above 80%, and no one knows what behaviors equate to what percentages. We don't have that data, so no one knows. I wish the governor had given us another week or two to really get our handle on the number of testing we're giving, to get to the levels that he said he wanted us to be at. I wish for an additional week or two we could get the contact tracing in place. I wish we had a better handle on our nursing homes before we were to do this. But now that it's happening, I want to try and make it happen as successful as we can. So we're going to continue to do the things that we can do locally to the best ensure that the governor's toe dipping does not result in another surge coming. So I expect that we'll do the same thing here we did with construction, and we'll have new orders that will take some of the behaviors that he recommends, and we'll mandate them here, just like we did on construction sites. And it looks like we're able to do that with everything except the face coverings. I was disappointed that the governor said we could no longer mandate that in particular. He recommends it, the lieutenant governor recommends it. I absolutely recommend it for this community. I personally will not be going into any business establishment that's not working very hard to make sure everyone in any place doesn't wear a face mask, and make sure that everyone does wear a face mask, and I think we should all do that.
I certainly want to talk about the testing and the contact tracing, and also this high number in nursing homes. But before we do that, it's a little bit confusing for people because Friday the state is supposed to gradually reopen. We understand May 8th, a week later, Austin will supposedly reopen. I know we'll talk a little bit more about that, but doesn't the state rule trump Austin rules? I mean, how will you enforce it if our rules are different, say, than the state of Texas? If we have stricter rules, how will you enforce it since things like the mask weren't enforceable?
Well, we're working on our rules, our new orders now. We purposely set the expiration of our orders to be a week after the governor's order would expire. That would give us a week, then up to a week, to be able to work on our new orders. But this is how I'm looking at it right now. We had a stay in place ordinance, a shelter in place ordinance before the governor entered one. So we were all operating under our rules. The governor came in and had his own shelter in place rule. I thought it was a very good thing. We didn't need it because we already had one, but his rule then applied to us and applied to the entire state, and that was a good thing. We had some of our rules that were more strict than what the governor wanted, and he changed that. So he came in with an order that said that while we cut off a lot of construction, he came back in and said, no, now we're going to open up construction. Well, he then trumps that, and we've opened up construction, but that doesn't stop us from being able to make sure that the construction that happens is done in the safest way possible. He gave an exception a week ago for retail stores to open up so long as they did curbside service. Okay, now that's allowed. Our overall scheme is and rules are still in force, but they've been modified to the extent that the governor has intervened and trumped us. Now he's done it with retail again. He's done it with restaurants, assuming a 25% occupancy. He's done it specifically with face masks and saying you can encourage that, but you can't mandate that. And he has now pulled back off his stay-at-home order, leaving just our stay-at-home order in place. He didn't say we couldn't have one. He withdrew his. And quite frankly, if we continue our work in our city, which is our shelter-in-place ordinance, with the exceptions that we were providing, and now with the new ones that the governor has added on, I think we have the best chance of helping the governor's toe dip actually work at a level that doesn't move physical interactions so low that we're now facing a second wave. So we'll come out with our orders. I think we'll extend our shelter at home, except for people in essential businesses, except for people that are participating in the businesses that the governor has said are open, except for exercising and all the things that we have. So we're going to, I would think, extend our orders subject to and taking into account the provisions that the governor has decreed in his.
So essentially, we will be going back to work. Well, you're going to be coming up with a plan May 8th. Is that
sometime before May 8th? We're going to have to come up with our orders because our orders expire on May 8th. So sometime before May 8th, we'll come back with orders that I think will still say we're going to be safest if everybody stays at home, with the following exceptions. The exceptions would be the things that are currently in our order as exceptions. And it will also include those things that the governor has also established as exceptions.
Okay. So you have a task force from the chamber recommending ways that we can reopen for business. How do you think those will differ from what the governor has put in place for Friday?
Well, again, the governor's rules will control, but there are still things we can do, and just the same with construction. The governor came back and said all construction should be open. Okay. Well, what we did here locally was we met with the construction industry. We looked at how that operates in our town, and we prescribed certain rules about how to do construction safely on those sites. We talked about some testing requirements, some physical symptom surveying, making sure that there was a health officer on site, making sure that tools were disinfected before they were passed around, not a one common water jug. We did those things. I suspect that we'll take a look at doing those kinds of things in some of the industries that are open. We're going to get some suggestions from that chamber organization who's broken up by industry. So we'll say, these are the things that they think are appropriate for these locations. We're also getting advice from worker groups and from the public health professionals. But our order contains, for example, Exhibit D, I think it is, which are the rules in Austin with respect to construction activity. The governor opened that up. We had some rules with respect to how to do that safely. I think we'll probably be looking at that same kind of thing.
I want to talk about testing and contact tracing because those, as you know, the science community has said those are the two big keys to keeping COVID-19 at bay. What scientists are you talking to? What have you heard about expanding testing? I understand that researchers say the city the size of Austin need like 2,000 tests a day to really get a good read on how we're doing. So where are we with testing and contact tracing?
Testing is really important. And quite frankly, if the governor's toe dip is going to be successful, it's going to be because we do testing really well. And the better we do testing, the more we're going to be able to dip our toe deeper into that water. Because what testing enables you to do is to diminish the number of opportunities for the infection to spread. Just like distancing decreases the number of instances where there'll be a virus spread. The more testing I can do, the earlier we can find people who are infected, the earlier we can get them to be isolated and not being around other people. The problem we have right now with this virus is there are a lot of people that have it that are in and around everybody else, but they're asymptomatic so that no one knows they have the virus. Or I have somebody who has a little bit of a scratchy throat and they figure they don't have the virus. It's probably just allergies or the like. And they actually go out and they're around people for 2 or 3 days and infecting people for 2 or 3 days until the symptoms get so bad that finally they get tested and they find that they have the virus. The more testing I have, the earlier I can test everyone who begins to even have a scratchy throat so we can minimize the number of infections. That's why testing is important. The more tests I have, the more people I can test, the more I can contain the virus. That's why it's important. And you are right. 2,000 tests a day would be a really good thing to do. That's the rough equivalent of what Harvard wanted, where we're testing 1.5 people per 1,000 per day. In our entire testing in Austin, since the beginning of this, we're talking about 10,000 people. So we are way behind being able to do 2,000 tests a day. The governor talked about doing 26,000 tests a day in Texas. Well, our proportionate share of those tests would be about 1,200, 1,250 tests a day. We're not at 1,200 or 1,250 tests a day. We probably have the capacity at this point to go up to about 800 tests a day. But over time, we're going to build that. My guess is, my expectation is that within the next week, week and a half, maybe 2 weeks, we will build up to that 1,000 tests a day level. That's one of the reasons why I wish the governor had given us a little bit more time to be able to get to that place. But we're going to bring in testing as quickly as we can to build it up. That's why we opened up the online portal for anybody to go on without a doctor, go through an assessment, makes you potentially eligible to get a free test. That's why we've opened up testing sites in the Eastern Crescent to get to populations that we weren't otherwise reaching, where we see an alarming number and rates potentially happening. So we're going to do testing as quickly as we can. It is important because it helps us dip our toe into the water without getting a second surge.
But the reality of it is that the level of testing that a lot of the scientists say is needed to get a true read on how this community is doing, that's not available yet, that level of testing.
2,000 tests a day is not available. The governor's 1,250 is not available. Okay. So we're going to be trying to do that as best we can. And there are 2 reasons to do the testing. One is to find the individual person so that we can isolate that person. The other reason to do the testing is to get a feel for what's happening in the community, to actually know what percentage of the population has the virus. And we don't know the answer to that question because we're not able to test the community generally. We've had to only give our tests to the people that have the symptoms or our first responders or have come into contact with the virus.
So what about contact tracing? You know, a lot of the countries that have had success stories keeping their COVID-19 rates down, New Zealand, Australia, places like this have pretty strict contact tracing techniques in place. What has been discussed at Austin City Hall about contact tracing, and what are you hearing from the state about doing that?
Absolutely a really important thing too. And for the same reason. Remember that if we have stopped the spread of this virus, we have stopped the spread, the infectivity, we've gotten to a 93 or 4% level. At that rate, we can see we have basically, narrowed and flattened the curve in our city. Testing will help us do that, but contact tracing will too. The sooner we can find people that are infected and contain that cluster or that group, the fewer people are going to get infected. So I have to be able to do the contact tracing. If I have somebody who is infectious and they were in touch with 15, 20 people over the last 2 or 3 days, and I don't know who those 15 or 20 people are, they could be out infecting other people for 3 or 4 days before they even know that they have potentially have the virus. If I know to go to them and say, you were just in contact with somebody yesterday who we know has it, you need to isolate yourself here. I'm going to increase the percentage of my reduction in the physical interactions that allow the virus to spread. Now, here in Austin, we put together an automated system that's part of that portal that you can go to, and we took it to the state. And the state now is taking that model and says they're going to bring it statewide. That's great. I wish we waited to do what we're doing until we actually had that in place. But we need to have that in place. The governor said he's going to put 1,000 more people, feet on the ground, to help with that contact tracing next week, up to 4,000 people. My hope here is that locally, we even expand on those numbers, because we need more people doing contact tracing if we're going to be able to avoid a second spike.
So the theme of most of your answers is, do you feel like the governor jumped the gun?
I think he did jump the gun. That said, it is our reality, and I'm going to be doing everything I can do right now to catch up and to help as best I can make this toe dip that the governor has initiated not something that leads us back to a second surge. I mean, that's the reality of where we are right now, and we are going to do our best to make it successful.
So the lead story in the Statesman today was about the high number of local nursing home deaths. About 2/3 of the deaths in this community at nursing homes, which I wasn't aware of. What are we going to do to, I've heard the term cocoon those folks and better protect this very vulnerable population?
It is a vulnerable population, and this is the cruelness of this virus, because it seeks out and finds the people in the community that are most vulnerable and susceptible. Older people, people that have lung disease or cardiovascular disease or a diabetic. You find a lot of those people with multiple conditions like that in our nursing homes. So it's not unusual or unexpected that you wouldn't find virus more there. It's like kindling in a forest fire, which is why we have to cocoon those susceptible populations. We have to take them off the grid as best we can. I mean, that's what we nearly need to do to help them. What we're doing is we're forming task forces. We have 3 formed now, deployed, a 4th one coming, 12-member teams. The state has participated with us to some extent in the formation of those teams to go into nursing homes and help. But that is one of the areas that keeps me up at night right now, because that is where our crisis is. And what the experts tell us is that if we're not successful in cocooning the nursing homes, then we will have a second surge, and a lot of people will die that don't need to die. So cocooning those nursing homes, helping to look at other susceptible populations, like the community of people experiencing homelessness, that we actually have to get off the street and into motels, get them isolated, get them into rooms. But we also have to look at the people who are diabetic and are not in nursing homes, and we need to make sure that they're not working in stores, and people with coronary artery disease and pulmonary disease. Those people need to sit this out as best we can. People over 60, 65 in our community generally need to sit this one out and let other people help them. We will not get back to normal until we have either the ability to test everybody every day, or until we have a vaccine or a way to treat this. I don't want people to watch what's happening now and think we have this beat. We don't have this beat. All we have done is we've learned that if everybody stays at home, we can stop this from spreading. Well, that's true. We knew that. We just weren't sure we could ever get everybody to stay at home. But we have an incredible community and they've done that. Thank God. But the virus is just as infectious, just as deadly as it was at the beginning of March. And every time I say we flattened the curve, I keep hearing in the back of my mind the nurse who heard me say that and said, "Don't say that. I'm in the hospital. I have been with people who were not allowed to have their family members with them. I have been with people that are dying. The curve was not flattened for them. These are people that are no longer with us." And that is very true. We are still in the middle of this. We are still in a fight, and we're going to be taking it pretty conservatively, my family.
And we don't really even know how accurately we're flattening the curve because there's not enough testing available to get solid numbers.
Well, we can get more solid. That if we could get better numbers, we would have a better chance of finding the infection early and stop it from spreading. We could keep the infection maybe to 2 or 3 people instead of every infection then spreading to 15, 20, 25 people. And that would help us stop the spread of the infection. And to the degree that I would get testing, I could learn that. But we have enough testing to know whether or not we have an accelerating line. And that's something that we learned over the last 6 weeks. And there's some peace of mind in knowing that if we are dipping our toe in the water too much, if we start having an accelerating line, if we're headed toward a spike, we now know that, and we have honed our data collection, we know that we will see the signals early enough for our community to be able to turn it off, either by going back to what we have right now or some other toggle back. But we have enough testing to know whether that's happening in our community. And quite frankly, we're really relying on hospitalization numbers, not confirmed case numbers. Because as we do more testing, we would expect the number of confirmed cases to go up, even if the virus in our city was going down, just because I'm testing and finding it in more and more places. But hospitalizations, that happens without regard to whether someone was tested or not. So I'm carefully watching our hospitalization numbers to see whether they're plateauing, to see whether they're retreating. And as we go into a new setting, I want to see what happens to the hospitalization numbers. That's why the other concern I have with what the governor did is he said, let's do this for 2 weeks and see how it looks, and then we'll go to phase 2. Well, the answer to that is we're not going to know in 2 weeks because there's a lag time associated with this. In order for me to really see the data, we have to go out 3 or 4 weeks to know whether something is working or not. Someone gets the virus, they're going to have it for 3, 4, 5, 6, 7 days, maybe before the symptoms manifest. As they begin to manifest, then maybe it takes that person, another 3 or 4 days to go get tested. Right now with the testing of the timing, it's another day or 2 before I get that back. Then I have my first data point. So the numbers that we're going to be seeing the numbers we're seeing today, were not determined by our practices today. They were determined by our practices 2 weeks ago. In 2 weeks, we're not going to know the impact of what the governor does. We're going to know the impact of what we are doing today. So it's going to be 3 or 4 weeks before we know what this new opening up is going to be. And I hope that the governor gives our state the time to be able to really assess the impact of the new behaviors.
Mayor, this pandemic has really magnified, shine a glaring light on the racial and economic disparities in our community. I'm wondering if this new light or more glaring light on these disparities has given you some more insight into these issues, given you some new solutions that will help bridge this gap between the haves and the have-nots in Austin, Texas.
Well, I think you're absolutely right. This virus has really laid bare the inequities and disparities that exist in our city. And certainly if somebody hadn't seen them before, it's impossible to deny them now. The fact that we have populations now that are having an elevated level of infectivity because they have underlying health issues that happen because of generations of not having healthy food and access to health care the way that others of us have enjoyed during that period of time is evident. What we have learned is that we can actually do something about those if we need to. So people in our city that don't have food, that wonder where their food was going to come from, it now is an exacerbated challenge. And we're now feeding more people than we have ever fed before. We're taking people experiencing homelessness off the street and we're putting them in conditions that are safer. What this teaches us in a very real sense is that none of us are safe unless all of us are safe, because our greatest susceptibilities, our greatest vulnerabilities are not just that community that is point, but it is all of us that are put at risk when any of us in a community are susceptible or vulnerable. If none of us were susceptible or vulnerable, we would be looking at this virus entirely differently than we're looking at it right now. We have to use this time as an opportunity to come out of this virus as a better city than we went into it. And my hope is a lot of the practices, the things that we're doing now, and maybe we couldn't quite do before, we're going to continue to do as we exit from this situation.
You mentioned the homeless population. I know this has been an issue that's been a very thorny topic during your second term, and it's a very divisive topic in our city. So do you see some of these procedures that have been put in place because of the pandemic being able to remain once we're on the other side of it to help get more homeless people off the streets?
I absolutely do. And you know, it was good we were having such an intense conversation about communities experiencing homelessness, because we were able to transition from those discussions to the surge planning and the practices we're now putting into place. In some respects, we are better off than other cities that had not had that conversation, that are now dealing with challenges in their communities experiencing homelessness, like we're looking at in nursing homes. But we had already adopted and were putting into place the hotel motel strategy. We were looking at, and we had talked about how we would do that and how we would build communities in those places. And now that's happening. We have 3 such facilities that are up and operating now. We have more that we're in negotiations with. One advantage we have now is we now have some federal money to help us acquire some of these locations. And at the end of this, to the degree that we're able to use that money to actually buy locations rather than renting locations, they will be with us when this is over. So the conversations we were having, as hard as they were in the lead up to this virus, have put us in a better place right now. And that is one of the areas where I am sure we will exit in a stronger place than we entered.
While we're talking about vulnerable communities and racial and disparities and looking at our city through this equity lens, I've got to ask about APD. Last week's deadly shooting of Mike Ramos once again put the police force front and center with some of these key civil rights complaints and racial issues. Now, some key civil rights leaders in our community are calling for you to fire Chief Manley. And I'm wondering what your response is to that, what procedures are in place to investigate this particular shooting, and where we go from here.
Well, I can certainly understand the concern that's been expressed. As I said, when I first had the opportunity to look at one of the videos that were taken by a bystander, that it's troubling. It's troubling to see Mike Ramos beside his car with his hands raised, saying he didn't have a weapon, showing his waistband to show that he doesn't have a weapon, and then he ends up dead. That there has got to be a better way. You can't pass judgment on this incident because you don't have all the facts yet, and I allow for the fact that I don't, and we need an investigation to be able to tell us if there were things that we should have seen or should know that we otherwise don't, which is why I asked the manager to give us a very prompt and thorough but accurate investigation of what happened here, and then to take whatever the appropriate steps are. But the use of force is such such a everlasting and forever power. It only really exists in the community to the degree to which there's trust between law enforcement and the community. And at this point right now, we have to build that trust. It is not in the strongest place it should be in, given the allegations we had with some pretty horrific emails. We had an investigation that came back relatively inconclusive. The manager was already moving toward an investigation of the overall culture to see what steps we needed to take before we bring on the cadet classes later in the year. So those issues are there, and we have to build trust between the community generally and certainly the communities of color. We have our quarterly review with the manager on Friday in executive session, and I'm sure this will be among the issues that are discussed. Ultimately, the decision to fire or not fire anybody that works in the city is really the city managers, other than 3 or 4 offices that the council appoints in addition to the city manager. But the police chief, that's a decision that he makes.
I think a lot of people don't realize that this really is a city manager strong government. I mean, that's the basis of the way Austin's government was set up. I want to move on to some workforce issues. Austin PBS is very involved in workforce and lifting up people into middle skill jobs. And I know this is a huge issue for you and the community, that there was a goal of lifting 10,000 people out of poverty into these middle skill jobs in the workforce plan. Has that changed because of the pandemic? Is the goal going to be loftier now? There are going to be more people looking for work?
I think that this virus will give us an opportunity in this arena, as in all arenas, to really come out of it in a better place than we went into it. Yes, the community set as a goal to take 10,000 people out of poverty and put them into middle skill jobs. And we were on track to get that done in the few years that we had set to accomplish it. Obviously, this virus is going to set us back as it sets us back citywide with respect to jobs. Yes, we're going to have to really redouble efforts to make sure that people get into jobs and get people into work. And I'm not sure anybody knows exactly what that looks like. But I was just in one of these Zoom calls yesterday with a few hundred people talking about the Make It movement here in the city to really reaffirm that there are so many jobs that are even currently available for people that have a certificate or a 2-year degree. You don't need a college degree to have a really well-paying job. This is a great opportunity for people to be able to train to get those jobs. And if you go to Workforce Solutions right now in Austin and apply for and get one of those jobs, it comes with free childcare. I mean, if there was ever a time that people should be taking advantage of those opportunities, I think this is one of them.
I think childcare is a real struggle for a lot of families. Now that school has been canceled for the rest of the year, if people's bosses say, I need to go back to work, there are hundreds of thousands of families going, what am I going to do about my kids? Is there anything that the city is looking at to provide some help with this whole childcare issue that so many families are facing right now?
There is, and there are work groups focused on childcare right now. We're getting some subsidies from the state to help keep open and expand childcare, certainly for essential workers and first responders. My hope is that a lot of employers won't call back in their employees, or will still abide by the county and the city's desire for most people to stay at home. unless it's an essential business or a business particularly allowed for by the governor, because that's really where most people need to be right now if we're going to avoid that second surge. But childcare is an absolutely huge issue. But you know what? Childcare was a huge issue before we had the virus. You know, there were a lot of families that were able to take care of that because they had kids in school, but there were a lot of families where childcare was just unaffordable, and it was the thing that was standing between them and getting that certificate or that 2-year degree that would then change the trajectory of those families for forever. And again, I hope and expect that the infrastructure we build with childcare during this period of time is something that we can build on and expand and becomes one of the really positive legacies of this time.
I want to talk about the fabric of Austin. You know, I love this city. I've chosen to make it, you know, my home forever. But we thrive on our live music scene and our restaurants and the Austin State Limits Music Festival and sporting events. And all of that is really in doubt right now. So do you think there's going to be an ACL festival or a long-run football in the fall? And how is our city going to adapt both from a revenue perspective and a cultural perspective to what could be this new normal?
You know, I'll tell you at the top line that I'm real doubtful we're going to have any gatherings of 100,000 people in the fall, and I'm not sure we have that kind of thing happening until we actually have either testing of everybody every day or a vaccine or something like that. Those things are critically important to us, as is the music.
Got a little ringer going on.
Is that you? I hope I don't lose you here.
I can hear you still.
You can? Okay.
Go ahead there.
Oh, my sense
is 5-minute warning. We're in the lightning round now.
Is that what it is? I'm sorry. All right. Can you hear me now?
I hear you. Can you hear me?
I can.
Okay.
So I don't think we'll have any of those big festivals. And obviously the music industry, those festivals are critically important to Austin and who we are. But that's not what makes Austin. What makes Austin are really the people that have self-selected to be here. It is a progressive community full of early adopters and innovators, incredibly creative and entrepreneurial people that are concerned about the environment and quality of life. Those things are true, and those people are us, and we are still here. The fact that we were able to turn on and dedicate ourselves to a 90% reduction in physical interaction at a time when it was unclear whether that could be achieved. And not only did we do it, but we were one of the first to really do it and brought along a lot of people with us. That's Austin's role. The fact that we've been able to do that as a community is one of the most grand displays of selfless behavior and communal behavior, which I hope continues with people continuing to wear the face coverings. I mean, that's who we are as a people, and that has not changed. And it's going to manifest itself in different ways at different times. We will get back to festivals in the old form or even a better new form, who knows? But the underlying spirit of this city, the culture of this city, the things that really made me want to stay in this city, other than being able to swim in Barton Springs, are with us.
Final question, Mayor. Yes, with the silver lining, we're all looking for silver linings. What are some of the silver linings for Austin that you see coming out of this pretty terrible time?
Well, you know, like I mentioned just a moment ago, you know, we canceled South by at a time when no one was doing that kind of thing. There was a lot of pushback, but the support that I got for doing that was pretty overwhelming too. A week or two after that, the real spike started happening in New York City. And what this is, Judy, is my next call coming in earlier than 4 o'clock. So what I remember about 2 weeks after we did South by Southwest, watching the television and seeing Governor Cuomo. And Governor Cuomo was facing the camera and he said, look at this spike. Look at what we're dealing with here. And don't think about it as something happening to somebody else, because this is your future in 2 weeks. And I remember watching that and being really scared to my bones because I couldn't be sure that wasn't true. But yet our community rallied and disciplined itself and was able to achieve something special. We have to continue doing that. It's the small things that you see happening in individual homes. It's the pictures and videos I get. It's a community that is doing what needs to be done, not because sheriffs are arresting people or police are putting people in jail. We're doing it as a community because it's the right thing we need to do to protect our neighbors.
All right, Mayor.
I love this city too.
Thank you so much for giving us your perspective on the pandemic and how the city is handling it. And I know your next call is ringing through, so I'm going to let you go. But we appreciate your time this afternoon very much, and stay safe.
Judy, you stay safe too. Thank you.
Take care.